Hello, everyone. Good afternoon, and welcome to the media briefing on this Wednesday. We're going to get started. We're very pleased to have 5th District Supervisor Mary Adams joining us today. There's been a lot of talk this last week about vaccination appointments opening for age 75 and older, and Mary has got some great information to help seniors who are trying to make those appointments gird themselves with patience. Hi, good afternoon, Supervisor.
Hello there. How is everybody doing today?
I think we're all good.
Great. Well, the two biggest questions that we get asked is, I'm eligible for a COVID vaccine. How do I get my shot? And the other one is, I'm not eligible for a shot. When am I going to get one? And those are those are the two critical questions that we get from everybody else. So what we'd like to do today is just talk a little bit about how we are going to be able to help people find out how they can get their vaccinations. First, I want to say that it's an absolute miracle that we have an FDA-approved vaccine in such a short amount of time. And as we struggle with the complexities of vaccinations at our local level, it's important that we really remember that. The amount of vaccine that comes to Monterey County from the state has not increased. Monterey County is moving forward with vaccinations of residents 75 plus while continuing with the first line healthcare workers. As I indicated, my office has asked that question about how, I'm older than 65, but I'm not yet 75. Why can't I get a vaccine when the state and other counties are vaccinating all adults 65 and older? So adults over the age of 75 are prioritized over the age of 65 because the risk of COVID complications increases exponentially with age. This is something we already know. Those 75 and older are at greater risk than those who are 65 to 74. People 75 and older have an 8 to 13 times higher risk of being hospitalized and a more than 200 times risk of greater chance of dying from COVID. So until the federal and the state governments are able to distribute additional vaccine allocations, the higher risk group needs to be prioritized if we want to get back to a more normal way of life. According to the health department, Monterey County has a population of 38,660 adults over the age of 75. There are 47,800 people between the ages of 65 and 74. If we're only getting a few thousand doses a week, it's going to take months to vaccinate this group. That's why we're advocating so strongly at the state level to revisit the vaccination allocation plan. A letter that was sent to members of the California State Legislature just this past, well, actually the beginning of the week from the California Department of Public Health indicates that California is receiving a vaccine allocation from the feds of about 450,000 doses a day. 450,000 doses a week. Those doses need to be divided up equitably between 61 health jurisdictions, that's like us, the Monterey County Health Department, and 9 multi-county entities. And those are the big places like Kaiser and Sutter. Santa Cruz County has at least 3 of these multi-county entities, which is why they're able to vaccinate so many more people.
Say it again.
Much,
the joint meeting, so it'll be on our Zoom. It'll be with our.
I'm sorry.
Hold on. I'm gonna find him. I'll try to mute him.
Thank you.
Go ahead. Sorry,
yes,
Mary.
I was saying Santa Cruz County has at least 3 of the multi-county entities like Kaiser, Sutter, Dignity, which is why they're able to vaccinate so many more people much more quickly than we are here in Monterey County. So it appears, though, that these multi-county entities, like Sutter, are accepting appointments from Monterey County residents. There's nothing inappropriate about that. One of the challenges we have had is that the state has frequently been changing its approach on how it's prioritizing which groups receive their vaccine. They're also changing strategies on how the vaccine will be distributed. For example, we're just hearing that CVS will be providing vaccines for local residents, but we don't know when, and we don't know exactly where. Please understand, I know how frustrating it is for people to go online to the local hospitals that are providing vaccines only to find appointments have already been booked. With the limited supply of vaccines, there's going to be a wait time to make appointments at these scheduled clinics. They'll fill up quickly, and unless additional vaccine supplies become available, it could take 4 to 5 months to provide shots for all the county residents who are just 75 and over. So the Board of Supervisors sent a letter to the governor requesting additional vaccines. Additionally, we've sent a letter advocating for a more equitable approach to how vaccines are allocated at the state level. And this would take into consideration large populations of healthcare workers, check, that's Monterey County, the essential workforce of migrant farm workers returning to our county in the next month or two, check, that's really us. But here's some tips on how you might help people register for upcoming clinics. And I know this sounds just, let me just go back. If you're 75 or older, sign up for a vaccine clinic at www.mcvaccinate.com. So that's mcvaccinate.com. And the best, when you go to that website, you'll see all of the clinics and you'll see which ones have available appointments open. So what I found, because I wanted to check it out, I haven't gotten a shot yet. I'm waiting to see how it works out for my age group. I wanted to just go through the whole process. But I did try on Monday, and when I went in Monday morning at around 8:30, there were a lot of slots that were open. So my suggestion to people would be to try going on Monday at the beginning of the week to see what's going to be available. So, and check regularly, check daily for updates and for clinic availabilities. They fill up so quickly because of the limited supply, but the site is updated as clinics are added. So that's the primary thing that I would recommend you do. Go to mcvaccinate.com and then just check it regularly, but start out in the morning, start out, like 8 or 9 o'clock or so, because the last time they filled up within 39 minutes. So and for people who are unaccustomed to, being on computers in the first place, it's very frustrating. The other thing you can do is contact your healthcare provider. They used to be called doctors. Some providers, such as hospital-related county and local medical clinics, have received vaccine and may be providing additional registrations. And then, of course, if you're a veteran, we'll be hearing more from the Monterey County Veterans Affairs Office in just a minute. It's, as I said, I know how frustrating this is, and all of us want to get back to normal. I mean, I hear from so many people, all I want to do is just be able to hug my grandchildren, or all I want to do is just have some friends over for dinner. I think we all understand this, and it is so difficult. One of the things that it makes me feel so sad for so many people in our county, because not everybody has this option. But if you are unaccustomed to working on a computer and you don't have a smartphone, because you can do all of this from a smartphone just as easily, sometimes even easier, see if there's maybe a close family member, somebody might live by, who can just sit on a telephone and walk you through how to do it if they can't come over, or a trusted friend. I know people are feeling so much more helpful. People want to be helpful to others these days. So if there's someone in the neighborhood, maybe, a younger person, they may be able just to help you they can go at home and telephone you, and you can sit at your computer, or you can work on your smartphone and see if you would be able to work forward in that way. There are plans in the works for a telephone registration support system, but I know that I just spoke to the group this morning, and it's not ready yet. And until it is ready, we don't want to flood them with it, but it would be terrific to be able to call a very simple number and get help on how to register. So that's pretty much what I thought I would say this morning, Maya. If people have questions, I'll be happy to try to answer them. But maybe a little conversation around this would be good.
Thank you very much, Supervisor Adams, for those great information and great points. I'd like to bring on Jason Cameron from Military and Veterans Affairs Office, who's going to take the ball from Supervisor Adams and add in a little bit more information about what veterans, what options there might be for veterans that they may not have thought about. Good afternoon, Jason.
Good afternoon. Thank you so much, Maya. Thank you so much, Mary, for saving a little piece for me. I know you probably skipped over a paragraph or so that you had there, so I appreciate it. What I wanted to do real quick was just kind of dive into the current situation with the VA, veterans of the county, kind of where we're at and where we're trying to go. So currently, the VA is offering the Pfizer vaccine to veterans that are already receiving care from the VA. So this is for veterans who are enrolled with VA healthcare, no matter how they got there. And what they're doing is they're providing these vaccines based on the CDC and VA risk criteria. For those veterans eligible for VA healthcare, the team will be reaching out to them directly based on the risk categories to get them scheduled for appointments. So it's important that all veterans enrolled in the VA healthcare should make sure that their contact information is up to date. Some folks, have registered, with the VA many years ago, and maybe they moved or what have you. So they want to make sure that they update their information. Veterans who are not enrolled or do not currently receive care from the VA, they can contact our office at MVAO, that's M as in Mike, V as in Victor, A as in Apple, O as in Oscar.org, MVAO.org, or call us at 831-647-7613 to explore options and eligibility for the VA healthcare system. The VA DoD outpatient clinic here in Marina is part of the greater VA Palo Alto healthcare system, of which there's about 67,000 veterans enrolled into that healthcare system, which consists of 3 inpatient facilities and 7 outpatient clinics. The Palo Alto healthcare system has administered 10,040 Pfizer vaccines to veterans and staff as of January 27th. So that's about 1/7 of their veteran enrolled participants. VA Palo Alto has now begun vaccinating high-risk veterans, beginning with homeless veterans, dialysis, transplant veterans, chemotherapy patients, and veterans over the age of 70. The VA is offering the vaccine to veterans who are at the greatest risk for infection and severe illnesses based on the CDC's guidelines, and will continue to work their way through the established priority groups. Again, the VA Palo Alto healthcare system is calling enrolled veterans in high-risk categories to schedule them for these appointments. In addition, veterans in these categories can be proactive and call the VA directly to schedule an appointment if they're in one of those priority groups. That number is 650-496-2535, or they can just contact us directly, my office, and we can give them that information. So if all else fails, contact my office. Currently, due to the Pfizer vaccine shipment limitations, being that they come in large quantities and storage capabilities, the VA COVID vaccinations are only being given at the Palo Alto, Menlo Park, and Livermore locations. So in other words, the Monterey County veteran population has to travel outside of the county to receive their vaccination. So that poses some issues for us because some of our veterans, especially in the older categories or high-risk areas, have travel limitations. Maybe they don't have a vehicle, maybe they can't drive, what have you, or maybe they just don't want to risk any more than they have to. So with that, the Marina Clinic does not have the ability to offer those vaccines. The Military and Veterans Affairs Office, in tandem with the Congressman's office, are working on identifying storage and redistribution solutions with the VA to enable the Marina Clinic to provide vaccines. We've been working on that diligently over the last probably week. And then with tremendous support from the Monterey County Board of Supervisors and the Congressman's office, we are championing the issuance of the Moderna vaccine to the VA Palo Alto healthcare system and specifically the VA DoD clinic in Marina, to more easily serve the veterans of the county. It's important to note that of the VA Palo Alto healthcare system, the highest concentration of elderly veterans are actually in our area. So it really makes it, the point gets driven home on why we need that vaccine here in a way that we can actually receive it and be able to administer it here at the Marina Clinic. And again, we're working on it twofold. One, trying to see what we can do with the Pfizer vaccine to get it to the Marina Clinic, how that would work. In addition to trying to get the other vaccine that's currently approved, which is the Moderna, and then potentially the Johnson & Johnson as well to that Marina Clinic. So those are all things that we're working on. The main issue right now, as you know, is the supply uncertainties that surround how much, what manufacturer, and when the VA will receive those additional vaccines. And to kind of piggyback on what Supervisor Adams was talking about with just the supply amount, the more that we can utilize the federal solution for vaccines to our county population, i.e. veterans using the VA system for their vaccines, then frees up county vaccines as well for other residents. So the faster we can do this, the better. And I appreciate all the support that we've gotten from all the elected officials throughout the county. With that concludes my briefing, pending any questions.
Thank you very much, Jason. Great news on how those efforts are going at the Marina Clinic. So we're going to take a pause here and have some questions for Jason. And well, Jason might be able to stay a little longer, but Supervisor Adams has to drop off at 12:30. So we're going to take some questions now. And I do have some questions in the queue, so I'm going to go ahead and ask them. The first one is for Supervisor Adams, and this is an opportunity to revisit some of the options for seniors. What is the county going to do to help senior citizens who do not have access to the internet or have the computer skills to sign up for vaccine appointments?
So as I mentioned, there is discussions going on right now, negotiations going on right now for a 24/7 telephone hotline that people would be able to go and get absolute hands-on help to complete their applications for an appointment to get a vaccine. It's also going to be available in multiple languages and indigenous languages as well.
And then in the meantime, you had recommendations to utilize friends and family. Don't wait. You can try now with a little assistance.
That's very true. Absolutely true.
All right. Next question, and this one is also for you, Supervisor Adams. Would you support a requirement that migrant farm workers traveling from Yuma to Monterey County next month be tested for COVID-19 before they are allowed to work here?
So that's something that we've been looking at. We're looking at a whole lot of things that have to do with the migrant workers who are going to be coming to the community. Everybody's very familiar, not everybody, but many of us are familiar and concerned about the article that was in the New York Times a couple of weeks ago about Yuma having the highest coronavirus ratio. I think it was something like 7 and 1 out of every 7 people in Yuma has COVID. So we're really aware of that. And fortunately, we have a great relationship with the agricultural industry, looking at what we can do to set up testing sites and what we can do to set up vaccination sites as well, so that we are able to test and vaccinate people who are coming here from Yuma and other places as well. Goes right back to the same problem, though. We've got to have the vaccine. We're advocating so strongly at the state level to be able to talk to the appropriate people to see if we can have a separate and very special vaccine allotment to be able to handle the 35,000 additional people that are coming into our community in the next couple of months.
Thank you for that. I have a question here, which may be for Dr. Moreno, but I will go ahead and pose it to you, Supervisor Adams, and then if we need to defer to Dr. Moreno, we can. It's regarding the CVS and vaccine. The CVS February 11th, according to their release, as far as they're going to have vaccine at CVS pharmacies. I'm going to paraphrase a little bit here. As far as where does the county know if there were conversations with CVS representatives as to where to have doses allocated to CVS pharmacies?
I don't know the answer to that. I saw that there are two places that they were saying CVS would be available for the vaccines, and that was Carmel and Monterey, and that Safeway was two different locations within Salinas. I don't know whether there were conversations with people from the county about where they should set up. My expectation, so I don't know the answer. I don't know if either Charles McKee or Dr. Moreno would have additional comment on that or not.
And I could defer to Dr. Moreno on the rest of that question. Thank you. And I think this is a question about VNA being used to vaccinate seniors, and I'm going to have to defer that one also to Dr. Moreno. Here's Supervisor Adams. Do I hear Karen?
No, I was going to make a comment that I just read something that I thought was of interest in the letter that we received from the California Department of Public Health to the legislature, and that is that healthcare providers like doctors and nurses who have retired and have not kept their licenses up have an opportunity now by a special waiver that the state is putting in place that people can apply through the California Department of Public Health if they have been licensed and they are no longer doing so, that they would have their the requirement for the continuing education credits waived and the fees waived, so they would be able to help with the vaccine program as well. There hasn't been a huge vaccination project like this since we were all dealing with polio back in the very, very early days of the 50s.
Certainly, and that is true. Moving on, we've got a question here about appointment requirements, and I'm going to defer that one to the health department and forward that one after the briefing to get a response for that. I have a question that I'm going to go ahead and answer. How will households facing language barriers be able to sign up for the vaccine? The registration page on the county website does translate to Spanish. You can pick your language option, and the entire page will translate, making it easier for people who prefer to use Spanish to make an appointment to do so. I'm going to move here, Supervisor Adams. Here's a question for you. What are your thoughts on CVS pharmacies in the Salinas Valley not being listed as part of the rollout of COVID-19 vaccinations next week?
My personal thoughts, it's a big mistake. I think that that CVS really needs to include the areas where we have the highest presence of COVID. And that's a simple thing by looking at the zip codes. I feel like in my mind, we ought to be focusing the resources in those areas, particularly if we want to get back to some sort of a normal life in the not too distant future. That's what we faced a year ago, and it's what we're going to face again if we aren't really diligent about ensuring that those areas where COVID is most present is addressed.
Thank you. And for this, the same reporter posed a question about how many people vaccinated per zip code, and I'll have to forward that one also to the health department for a response for that. I don't have anyone on the call that can answer that question. Here's one for you, Jason. Is the VA in Marina able to help those veterans wanting to get vaccinated with transportation to the Palo Alto area to get doses?
No, that's a great question, and I apologize for leaving out that answer. That should have been put into my brief. So, yes, the VA Palo Alto healthcare system has a van that will run from the VA clinic here in Marina to the VA in Palo Alto. So that's an easy one. We've also worked diligently over the past, I don't know, probably 6 months or so with MST to provide some different routes throughout the county to bring folks to the clinic at a low or no cost fare for the veterans throughout the county. In addition, in a partnership with from the county to Veterans Transition Center, they also have a van ride program where we can work with them as well if people are in a non-bus route through MST. And additionally, the Disabled American Veterans, the DAV, which is a veteran organization, also has a van or two that can also utilize that. Our office, the Military and Veterans Affairs Office for the County of Monterey, can be the hub for all of that information distribution. Contact our office and we can help any veteran figure out what's the best solution for their travel need to the clinic in order to get to Palo Alto for vaccines. So again, our office is the main contact for that, and we will take the ball from there to make it easy for the veteran. Thank you.
Thank you, Jason. And then I've got a question for you, Supervisor Adams, and this goes to your experience with 211. How many volunteers or staff would be needed for a 24/7 hotline?
Well, a lot. The good news though is that for the hotline that we're talking about, they have it's staffed, so there would be people who would be able to work on that. It would not be staffed by volunteers. It would be staffed at this point, to my knowledge, it would be staffed by regular people who are paid to do the work that they do. And they have to go through training to be able to respond to the kinds of questions that are often asked. My expectation, and I have not heard differently, is that it would be staffed by paid professionals.
Thank you. And then Jason, if you would reiterate the phone number again for people who are not on the Zoom call.
Sure. So the main number for our office is 831-647-7613. And that will go directly to our front office staff that answer the phone. And they can also visit our website at mvao.org. And there's also some good information there and ways to contact us as well.
Thank you very much, Jason. Oh, well, hold on. Before you leave, I've got one question for you. Is your ability to vaccinate veterans locally in Marina purely based on storage, hence the need for a special vaccine freezer, the ultra low freezer?
So that is the smaller of the problems. I believe that a freezer would be easily obtainable either through the VA. They don't cost that much in the big picture of things, or even getting one donated or purchased through private funds from different veteran residents who would want to make that happen. So I think the freezer is the smaller of the problem. The bigger problem, which we're working with the VA on, is the ability to demonstrate that they would have to, and forgive me for butchering the numbers, I believe that the Pfizer vaccine comes in kind of a bundle of 900 plus vials, servings, whatever. So with that, the VA clinic would have to show that they are going to utilize that many. So they would have to show that they have that many not just veterans in the high risk category that would be administered that amount of vaccine, but also that are willing to come get that vaccine, because just because you have people in the group doesn't mean that they're going to take them. So that's part of it that we're working on. Then the second piece is through the California Department of Public Health. They have to bless off where these vaccines are sent, because it's throughout California. So they have to bless off the receiving entity. And I don't know at this point if by default the clinic either is not bound by that because it's federal, or if it would be coupled into the Palo Alto healthcare systems just overall reach, that they have different locations and it really doesn't matter where it falls. So again, we're working on several different pieces, and we're working with the congressman's office, like I said, at the federal level from kind of the top down, working with the VA, and then our office is working at the local level with the clinic to really find out what the barriers are and help knock those down. And we will get state legislature and the county's already in the process. They're supported wholeheartedly. So whatever the hurdles are, we will break them down and make whatever needs to happen.
Excellent.
That is great to hear. Thank you. And I see it's 12:30 and we need to let Supervisor Adams go. Thank you very much for being with us as long as you could today.
Thank you. Thanks so much. Good luck, everybody. Bye-bye.
Bye. So now we're going to go back into our presenters, and we've got Dr. Caroline Kennedy from our Monterey County clinics on, and she's going to talk a little bit about the process that the clinics have been going through. They have the vaccine, and then they've been making appointments and working with people 75 and older. And this is a great chance to hear how it's going. Good afternoon, Dr. Kennedy. You're on mute.
I have to unmute myself twice. Can you hear me now?
I sure can. Thank you.
Perfect. Double mute. Sorry about that. So my name is Dr. Caroline Kennedy, and I've been able to present to you before. I work at the health center, our health department clinics. We are federally qualified community health centers, and we serve about 40,000 patients. So today I'm just going to give you a brief example of what we've done with what is called a closed pod, meaning we only are vaccinating our own patients. First, I wanted to say that our clinics, F2HCs, and our clinics are located close to the people that are at the higher risk. These are the people that live in this exact zip codes we've been talking about, these densely populated areas. And we reserve our resources for that exact patient population. Many come from multi-generational households, and these are the exact group that's been disproportionately borne the brunt of the COVID illness, both mortality and morbidity. And they have a long history of health inequity. So this is the same group, as we've all discussed today, that have access to internet is limited, often do not speak English as their first language. They do not have a computer in their home, and navigating tech is quite difficult. We know this from our own access, from people that have accessed our own charts through Epic. They don't use the portal. They don't want to access their COVID results. It's what they would prefer for us to reach out to them and speak to them on the phone. We also serve a high rate of immigrants, like I mentioned before, that don't speak English as their first language, and there are people of color. And we know from the data from around the country that they have significant difficulties getting vaccine. There's more vaccine hesitancy, and they get vaccine at a lower rate. So with all that background, we knew that we had around 1,100 patients, 75 and plus, from our data from our electronic medical record. We received Moderna vaccine, so we received enough for 300 patients, both their first and second dose. 200 of those are in our Salinas clinics, and 100 of them went to our Seaside clinic. We defined our patient population, those who have been seen in the last 2 years, the day that we received the vaccine. So we couldn't get any new people that would try to, get access to our vaccine instead of our current patient population, which is what we're dedicated to. We also had the ability to ask our providers for their own priority list. So they knew who their patients were most fragile and at risk for complications and death. That may be from a socioeconomic standpoint or from a medical standpoint. And then we decided to put everyone on equal footing and reach out everyone on the phone. We did not offer the tech-savvy people the ability to get the vaccine first. We just went down the list somewhat randomly through all of our patients and called them. One of the beautiful things about giving it to a community health center and you're using your own electronic medical record is we do not require any forms to be filled out online. We do not require any proof of ID. And these patients are already in our system. We know exactly how old they are. So basically, it was a verbal contract. Would you like to come in? Would you like to come in at Tuesday at 10? They did not have to jump through any of the other hoops. I wanted to say that we were able in our 3 different locations, one of them we're using a hallway, distancing people 10 feet apart and giving them timers in one of the hallways in our clinics. We used exam rooms for them to wait after the 15 minutes after they were vaccinated. Some were done outside in their cars. And then we do have a large waiting room that we converted from a waiting room to a room, the post-vaccine room. We are really sensitive to people speaking other languages other than English. Almost all of I'd say 95% of the people that work in our clinics are bilingual. So Spanish seems like a normal language to us. All languages are normal, but we have been able to offer interpretation for those who came in Russian, for example, who just really didn't understand what they were getting themselves into. And our community health centers have the time and we will take the time so that each person of all languages understands what we're offering them and what we are able to do. We have already scheduled their second dose. When they left the building, we scheduled them a second dose and handed that to them so that we don't have to worry about them all calling in and being confused about where to get the second dose. We have ordered them for 5 of our 6 physical sites. And when more vaccine is available, we do expect to be able to offer it during regular clinic visits because there's nothing like having a one-on-one conversation with a person that has vaccine hesitancy. And we're really able to cajole more people into getting vaccinated when they're sitting across from us in the same room. I wanted to say a few things that we've learned and have found is that, this patient population was slowly, based on age physically, but in reality for scheduling standpoint as well. We tried, we received the vaccine on a Wednesday, started vaccinating on a Thursday, and we thought that we would have more people be able to just show up the next day, but that wasn't the case. Our patients had even less access to transportation than we even anticipated, and we needed to be quite flexible. Often they have to ask their children to take a day off of work, and those are essential workers, and that is important income for the entire family. So we have had to become more flexible. Some of them require their IHSS worker to take them or MST, and that takes time. Can't just say show up between 9 and 10 tomorrow. That wouldn't work. So it takes more time to get this patient population, but it is an extremely important patient population. Not to mention the fact that they have this great fear of what's inside the vaccine, the safety and distrust. We had the added benefit that anyone who opted out of this vaccine, we actually made a telephone encounter, which is what we call them in our system, and we had their primary care provider reach out to them, and we were able to convince 40% more patients just with one phone call from someone they trusted. So overall, I wanted to give you an idea of what a closed pod can do for a patient population that really needs the vaccine. FQHCs and other clinics in our area, even doctors on duty or SVMH clinics or Natividad clinics, are uniquely poised to help do closed pods and reach this patient population because we're a trusted source. I know we're all just waiting the issue of having more vaccine available for our community. I wanted to thank the health department for allocating vaccine to us in this closed pod, kind of in a quality improvement thing. It's a plan, do, study, act to see how we can do this best for our patient population. And I really support the health department in devising strategies to reach these communities in a way that's completely verbal. Call centers, allowing them just on the phone to sign up, give everything they need to sign up for the vaccine, especially putting vaccines into the actual zip codes where people are already living. Walking distance from their home is essential, and allowing people to sign up on the spot and be extremely flexible for scheduling, given all of the limitations of this patient population. So thank you for your time today.
Thank you, Dr. Kennedy, for that really thorough look at that closed pod and how it can be successful. If you would stay on the line, we've got one more presenter and then I've got some questions for you. Our last presenter is our friend Danaegel from Monterey County Behavioral Health. And the last time you were on, I believe you led us in a relaxation meditation, but this time I think we've got some great news about some new offerings from behavioral health. Good afternoon.
Good afternoon. Thank you for inviting me back and letting me be here today. It is so important as we're thinking about our community members to make sure that we're addressing also the mental health aspects. We know for a lot of people, the increased stressors, the isolation, the negative impacts on income, family systems that are addressing multiple challenges, including the prolonged distance learning. It's really impacting people in a lot of ways. And so we're trying to make information accessible to our community members. And so this week we've launched a new website. I will put that in the chat for folks. And Mia, is it okay if I share my screen with folks to show them a couple of things?
Please, yes, okay, please do.
Okay. I will make this, I won't belabor things. So this is what our new website looks like. I'm pleased that it is fully available in English and in Spanish. So you see up here, there's a button that will either say English or Espanol, and the website has been fully created in each language. So it's not just utilizing Google Translate, which is very helpful. However, we have the information again in English and in Spanish. I'm going to go back to English because that is my primary language. One new thing that we have organized on our website are information and resources on a variety of topics, including COVID-19 supports, as well as supports that are available in the community. These are all accessible, free supports that we really want people to know about. We also have information about how to access Monterey County Behavioral Health Services. So for some of you who may know, Monterey County Behavioral Health largely serves individuals that have Medi-Cal beneficiaries who have moderate to severe mental health issues. However, we also work in partnership with Beacon Health Options, who provides mental health services for Medi-Cal beneficiaries with less acute mental health conditions. And we also will help individuals figure out where to go. We are the public safety net, and so if individuals do not have documentation status and or insurance and have really acute mental health issues, we will serve them, and we will also help them get where they need to be. And so again, we know that many people are experiencing crises during this time. We want people to know where to go, where to reach out. We're keeping an eye on suicide rates, for example, again, knowing how much stress our community is under. And we want to make sure that if somebody is having concerns, thoughts about suicide, that they know exactly where to go. One new resource that folks might not know about is in regards to a mobile response team for children and youth. This is available for all Monterey County residents that have children and youth up to age 25. And we have a phone number on the website where people can call to get more information and or to request out the mobile crisis team support. And then we have suicide prevention hotline numbers, as well as some different texting options that are available. The last thing I want to talk about is our next series of online classes, and they also can be accessed via the phone, what we're calling our Forward Together, Avanzando Juntos effort. And so we are offering support groups and informational sessions on a variety of topics, really focused on helping parents and family members understand child development, common mental health conditions and warning signs, as well as the impact of trauma. And our parenting module, we're offering some sessions in a partnership with a local organization, Partners for Peace, where they will provide tips and work with parents around how to really support their child and youth in the virtual learning environment. Just a couple of quick more things to mention. We have sessions for mothers with new babies. We know that this is a stressful time under usual conditions, and with the added isolation that many families are experiencing, they're cut off from their normal or their kind of regular relatives and caregiver support. So we have a support group for mamas and new babies, as well as sessions for teens. And this series, we are offering one on social justice, as well as teen mental health and wellness topics. So I think that that's about all I wanted to share. And I will put a shortened link to our behavioral health website in the chat. And Mia, I will share with you 2 flyers that have all the comprehensive information about the Forward Together series. If you could please help me get it out to folks in the media. Monterey County Behavioral Health can be stretched a little bit, and we really rely on your support, on everyone's support here today to help us get messages out to the community on how they can take care of their mental health and well-being. So thank you.
Happy to help, and thank you, Dana, for coming on and showing us all the great things you've got going on there. So I've got one, if anyone has any questions for Dana or Dr. Kennedy, this is the time to send them. I have one question for you, Dr. Kennedy, in chat. The CDC requires clinics that administer COVID-19 vaccine to keep track of spoiled doses. Is Monterey County keeping track of COVID-19 vax doses that have become spoiled in its own clinics?
Yeah, we have yet to have any spoil. They would spoil if they were opened for 6 hours. For Moderna, for example, they have to be open only 6 hours. So if there's one at the end of the day, we have not had any issue with that, being spoiled. But I know that when we are signed up for CalVax, it does require us to put in information about how much we have left. And if we did have any spoil, we'd make sure we know how to report that. But as of yet, we have not had a single dose spoil.
All right, thank you. And then for all who are on the chat, Dana put in the new behavioral health link. And for people who are not on the chat, I'll tell you, it's www.mtyhd.org/BH for behavioral health. And that is all the questions that I have in chat. Is there anyone who wants to squeeze in one last question before we wrap up the briefing? No. So thank you very much for joining us on the briefing today. Our next briefing is next week, and we'll see you then. Bye-bye.